first off, I'm going to shut her curtains so that I can provide privacy for her, and I'm going to wash my hands. Now I'm going to ask my patient to state her name and date of birth for me.
Catherine M. Robinson, March 14, 1996.
Okay, that looks good. So do you happen to know what time it is?
11.
And where are you at?
Twin Oaks.
Okay, so my patient is oriented times 3. What's the reason you're here for?
For my assessment.
Okay. Do you have any allergies that I need to know before we begin?
No.
Okay. Now I'm going to go ahead and assess her eyes for Perla, and that stands for pupils are round, reactive to light, and accommodation. Perla stands for pupils are equal bilaterally, round, reactive to light, and accommodation. So I'm going to go ahead and look at her pupils, and they both are equal bilaterally. Now I'm going to, they're also round, the shape is good. Now I'm going to assess her reaction to light. So I'm just going to have you stare straight to the wall. Okay, so her eyes react to light, so that's good. Now just stare straight at the wall for me. Stare at my finger. Okay, good. So her eyes accommodated for the distance. Now I'm going to begin the head assessment, and I'm going to throw on some gloves, some clean gloves. I'm going to go ahead and start palpating her scalp and look for any signs of any masses, any lesions, any tenderness that she could possibly experience. And I'm also going to inspect her hair, and her hair looks good, good and healthy. So now I'm going to move down to her external eye structures, and that includes her eyebrows, her eyelashes, her eyelid, her conjunctiva. And so her eyebrows are equal bilaterally and symmetric, and there doesn't seem to be any hair loss in her eyebrows or her eyelashes, so that's good. Her sclera is nice and white, and her conjunctiva is nice, moist and pink. It's not pale or red or anything like that, so that's good. Next I'm going to go ahead and check her nose to see if there's anything obstructing her airways. So just look up for me. Alright. Okay, good. So there's nothing in her nostrils. And can you open your mouth for me so I can check your oral cavity? Okay, stick your tongue out. Good. Lift it up for me, please. Okay. I'm going to go ahead and check all of her teeth. Okay, they all seem to be here, and they're all nice and white. Her oral mucosa is moist and pink, and I didn't find any abnormalities in there. Okay, so next I'm going to go ahead and check her ears, see if there's anything obstructing her auditory canal. I'm going to go ahead and look in her left ear. Okay, good. Good. Okay. I'm going to go ahead and palpate her ears and make sure she doesn't have any tenderness or masses in her ears. So just tell me if you feel any pain or tenderness. Anything? Okay, good. So my patient has no tenderness or masses that I noticed. Now I'm going to I'm going to test her hearing with friction rub. So just let me know whenever you hear something, okay? Okay. Good. So my patient's hearing is intact, and her quality of speech is good. It's not slurred or anything, and her speech comprehension is good. She's understanding what I'm saying. Now I'm going to go ahead and palpate her temporal arteries. Check for pulses on both sides. Okay, both are, I palpated both pulses, and there's no abnormalities in them. The rate and rhythm is good, and they appear to be 2+. So now I'm going to go ahead and ask my patient to make some faces at me. So just copy the faces I make, okay? So can you squint your eyes real hard? Okay, good. Can you puff out your cheeks for me? Okay, and smile real big like this. Okay, good. Now I'm going to check for any palpable lymph nodes. I'm going to start behind your ear. Okay, I'm going to go down her neck. Check under her chin. Okay, I'm going to go right back up. Okay, so I didn't find any palpable lymph nodes, and that's good. So now I'm going to check her carotid arteries one at a time to make sure she doesn't pass out. So, okay. Okay, so while I'm at it, I'm going to go ahead and check those carotid arteries for any bruise with the bell of my stethoscope. Just hold your breath for me, please. Okay, keep holding your breath. Okay, very good. You can breathe now. So I didn't find any bruise in her arteries, so that's good. Now I'm going to go ahead and check for any jugular vein distension. So if you could just lift your head back and lean back just a little bit. Okay. Okay, so I did not find any jugular vein distensions, so that's a good thing. Lastly, I'm going to go ahead and check for the alignment of her trachea, see if it's to make sure it's not deviating to either side. So I'm just going to palpate your trachea. Okay, so her trachea is lined up straight, and it has moved slightly to the left and right, and there's no deviations in it, so that's good. Now I'm going to begin my chest assessment on my patient, and first off I'm going to observe my patient's chest for symmetry and her chest expansion, and I'm also going to look for her AP to L ratio, which should be 1 to 2, and it is, it's 1 to 2. Now I'm going to check for her chest expansion as she breathes. So I'm going to place my hands on her chest, and I'm just going to ask my patient to take a deep breath. Alright, good. I'm going to do the same thing on the back side. So I'm just going to ask my patient to breathe. Alright, very good. So both my thumbs moved equal widths apart so that she has symmetric lung expansion. Now I'm going to go ahead and auscultate for her lung sounds using the diaphragm of my stethoscope. Alright, so I'm going to be asking you to take deep breaths, and if you start feeling lightheaded or if you need a break or anything, just let me know, okay? So take a deep breath. Alright, deep breath. Okay, deep breath. Deep breath. Alright, deep breath. Deep breath. Okay, deep breath. Deep breath. Deep breath. And one more. Okay, very good. So I didn't notice any adventitious lung sounds, and those could include bronchi, wheezes, and crackles, and things like that. So now I'm going to check for her posterior lung sounds and see if I hear any adventitious lung sounds there. Again, I'm going to be asking you to take deep breaths. If you need a break or if you're feeling lightheaded, just let me know, okay? Take a deep breath. Alright, good. Take a deep breath. Okay, deep breath. 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 One more. Alright, very good. So I did not notice any adventitious lung sounds. So now I'm going to check her lateral lung sounds for any adventitious sounds. So if you could just lift your arms up. Okay. Deep breath for me. Okay, good. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Again. And last one. Okay, very good. So I did not hear any adventitious lung sounds overall. So now I'm going to go ahead and also take her heart sounds, her cardiac sounds, and I'm going to be doing this with the eight-man order, and that is the aortic, pulmonic, herbs, tricuspid, and mitral, which is also the apical pulse. So I'm going to go ahead and start auscultating that with the diaphragm of my stethoscope. Okay. Now when I get to the apical pulse, I'm going to go ahead and listen to that for a full minute. Okay, so it's been a full minute, and her apical pulse rate was 80. So that's within normal range. And immediately after I finished listening to her apical pulse rate, I went ahead and checked her respiratory rate and the quality of her respirations, and it was good. It was 16, so that's within normal range also. So now that I've auscultated the cardiac sounds with the diaphragm, I'm going to go ahead and re-auscultate with the bell to check for any murmurs or anything like that. Okay, so I did not hear any murmurs at all, so that's good. Lastly, I'm going to go ahead and palpate my patient's thorax for any tenderness or masses, possibly any lesions and that kind of stuff. So just let me know if you feel any pain or tenderness, alright? Do you feel anything?
No.
No pain?
No.
Okay. good. So my patient does not have any tenderness. I did not find any masses or anything like that, any abnormalities in her chest. So now I'm going to move on to the abdomen assessment. So if you could just lay back for me on the table. Okay, good. So first off, I'm going to lift up my patient's shirt just to reveal her abdomen. Okay. So first thing I'm going to do is I'm just going to get eye level with her abdomen, just so I can get a good view of the surface, make sure she doesn't have any masses or possibly any distensions, anything like that. And she doesn't, and her abdomen seems to be symmetric on both sides, so that's good. Now I'm going to go ahead and also tape for her bowel sounds in all 4 quadrants, and I'm going to start in the upper right quadrant. And I'm going to listen with the diaphragm of my stethoscope. So I'm here in the upper right quadrant. Okay. I'm in the upper left quadrant now. Alright, now the lower left quadrant. Okay, and the lower right quadrant. Okay, very good. So I heard her bowel sounds every 5 to 6 seconds, so that's good, that's normal. Now I'm going to go ahead and also tape her arteries. So that includes the aortic artery, the right and left renal arteries, the right and left iliac arteries, and the right and left femoral arteries. And I'm going to listen to those with the belt of my stethoscope. So I'm at the aortic artery, and that's good. Alright, so I'm going to go down to the left renal artery. Now the right renal artery. The right iliac artery. Left iliac artery. The left femoral artery. And then the right femoral artery. Okay, and that's all good. I did not hear any abnormal sounds. So now I'm going to ask my patient if she feels any pain or tenderness in any part of her abdomen.
No.
And she states that she doesn't. So now I'm going to go ahead and do some light palpations in all 4 quadrants. And if you feel any pain or tenderness, just let me know, okay?
Okay.
Okay, so you didn't feel any pain at all?
No.
Okay, good. So now that she hasn't felt any pain, I'm going to go ahead and start my deep palpations. Again, if you feel any pain, just let me know, okay?
Okay.
No pain?
No.
Okay, very good. So we're done with the abdomen assessment. So you can go ahead and sit back up for me, please. Alright, very good. Now we're going to go ahead and begin the peripheral assessment. I'm going to just start off by asking my patient to squeeze my fingers as hard as she can. Squeeze. Okay, very good. She can grip with both hands, and the strength is both equal on both sides. So now I'm going to go ahead and ask her to roll up her sleeves. And what I'm going to do is I'm going to just observe her skin color, see if it's appropriate for her race and ethnicity. I'm going to just check for any signs of swelling, redness, discolorations, or anything, any signs of edema like that. So I'm gonna see if she has any pitting in her upper extremities. Okay, so there's no pitting. I'm gonna check her skin turgor in both upper extremities. Okay, so the skin retracts back instantaneously, so that's good. Now I'm gonna go ahead and just assess her hands. Make sure there's no discolorations, no tenderness, no lesions, anything like that. So that looks good. I'm gonna go ahead and I'm just gonna go ahead and check the capillary refill in both hands. Okay. Very good. So her capillary refill time was less than 2 seconds and it was instantaneous. So that's good and normal. I'm gonna now check for clubbing of her fingernails. So I'm gonna ask my patient to just put her fingers in together like this. And what I'm gonna be looking for is I'm gonna be looking for a space in between her nails, and there is, so that's good. Now I'm just going to ask my patient to, I'm just gonna roll up your pants for you, okay? Does that feel okay? Alright. Is that fine? Okay, good. So now I'm going to basically do the same thing to her lower extremities as I did her upper extremities. And actually I'm going to check her radial pulses first and see if they are symmetric bilaterally. Okay, so pulses, rate, and rhythms were symmetric and normal, so that's good. I'm gonna move down to her lower extremities. So first off, I'm just gonna assess the color, see if there's any redness or swelling, or if she's pale or anything like that. I'm gonna go ahead and check for any pitting. Okay, so there's no pitting in her lower extremities. I'm going to go ahead and check her skin turgor. Okay, so her skin retracted back instantaneously again, so that's very good. I'm going to go ahead and check her pulses on her feet. I'm going to check her posterior tibial pulse. Okay, so those were both symmetric and the rate and rhythm were normal. So now I'm going to check her dorsalis pedis pulse. Okay, and both of those were also symmetric to each other. I'm going to go ahead now and I'm going to assess her feet for any signs of lesions, swelling, or anything like that, any masses. And I'm going to go ahead and check her capillary refill in her toes on both feet too. Okay. I'm going to assess this foot also. Check her capillary refill. Okay, so everything looks good on her feet, and her capillary refill time on both feet were less than 2 seconds. They were instantaneous. So now I'm going to check for her sensation on the bottom of her feet. So I'm just going to ask you to close your eyes and just let me know whenever you feel something, okay?
Okay. I feel it.
Okay.
I feel it.
Okay, good. So she has sensation in her feet, so that's very good. So I'm just going to roll down her pants now. Okay, very good. Now I'm just going to check for a Hohmann's sign. So if you can just lay back again on the table. Okay, very good. So just relax your legs, okay? And I'm going to dorsiflex your feet up towards your head. And just let me know if you have any pain in your calves, okay?
Okay.
Alright. Feel anything?
No.
Okay. Same thing, just relax your leg. I'm going to flex your foot up. Just let me know if you have any pains in your calf. Feel anything?
No.
Okay, good. You can go ahead and sit up now. So she has a negative sign for the Homans test. So that's very good. Lastly, I'm going to ask my patient to just stand up for me, please. Okay, so I want you to just walk straight to the wall for me, please, just normally. Okay, very good. So when you walk back, could you do heel to toe for me, please? Okay, very good. Just, you can come back over here. So my patient's gait is stable and steady. She didn't need any assistance, just walking, and she didn't fumble around or anything like that. So now we're going to test her for a Romberg's with a Romberg's test. So what that is I'm going to have you stand with your feet together and your arms at your side. Could you just step up a little bit so you're not on the table? Okay, so just feet together, hands to the side. Just close your eyes. Alright, so I'm just going to watch her and make sure she doesn't fall or anything. And she has to stand like this for 5 seconds. And so it's been 5 seconds, so that's good. She has a negative Romberg's test. And now we're just going to test her range of motions. So if you can just start by putting your arms out like this. Alright, making big circles for me like that. Backwards. Okay, very good. Can you lift your hands out straight for me? Can you bend them? Bend your arms. Straighten them out again. Okay, good. Can you maybe roll your wrists around? Okay, can you alright, very good. Now, can you lift over your knees like this? Alright, good. Good. Okay, can you twirl your neck around like this? Okay, very good. Can you lift your legs out to the side for me? Okay, the other one. Okay, can you lift them out straight in front? Okay, straight in front. Okay, can you roll your ankles around? Very good. And your other one? Okay, and can you lift your leg backwards? Other one. Okay, very good. So that concludes my head to toe assessment. Thank you.